I'm Dr. Jennifer Sue, and I practice private practice, OBGYN, and integrative medicine, and this is my husband.
Hi, my name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and again, welcome to our YouTube channel. I want to remind everybody that this channel is commercial free and unbiased. We do a lot of background research and evidence-based practices that we mention here on our channel, and I want everybody to know that there's a lot of stuff that you can get on the internet right now which is not always accurate.
We upload one video a week on medical topics with an integrative medicine approach to treatment because we want to treat the body as a whole, because we believe in the ability for your body to heal itself. So if you haven't subscribed, please consider doing so, and if you like this video, give it a thumbs up. Today's topic is rheumatoid arthritis, which is different than the topic we covered last week, which was osteoarthritis. Rheumatoid arthritis is different than the osteoarthritis that we covered last week. Osteoarthritis is the kind of arthritis that we get with age, and it's stiffness that occurs in different joints in the morning, but it quickly goes away, usually just in a couple minutes. Rheumatoid arthritis is a lot different. Rheumatoid arthritis is actually an autoimmune disease, which means that your body's attacking its own joints. And eventually, if untreated, it can really ruin a lot of your other organs. And this is a lifelong illness. It cannot be cured, but it can be treated so the long-term effects aren't as bad. So what you have with rheumatoid arthritis is you have attack on your synovial joints in the joints of your body. So you have an inflammation. So you've got inflammation, stiffness, and pain in different joints in your body. Now the difference between rheumatoid arthritis and osteoarthritis is that the rheumatoid arthritis does not go away quickly. Like in the morning, your morning stiffness will last more than an hour. And usually in the hands, if you notice stiffness in your joints, the other arthritis is usually in these last two areas of each finger. But in the rheumatoid arthritis, it's actually lower in these two joints. And so there's also symmetry, so it's always in both sides, which means like if you divide up our bodies, there's symmetry. It always happens in both joints on both sides of the body. And the other thing is if you squeeze the joints, they hurt a lot when you squeeze them. So it's really, really important to kind of know some of the basic symptoms of it so that you can talk to your doctor about it. Because if you find it early enough and get on some kind of treatment within 3 months of developing it, your long-term problems from it are a lot less. And so you'll suffer a lot less in your life from it because this is lifelong. Your doctor will probably tell you to stop smoking, stop caffeine, and also stop drinking alcohol and limiting like your sugars and stuff. And they also want to put you on some medications. Now, as integrative medicine physicians, we want their treatments to really benefit you so that your body works with the treatment. Your doctor will want to put you on medications called DMARDs, D-M-A-R-D-S, which stand for disease-modifying anti-rheumatoid drugs. And the most common that you always hear about are methotrexate, but there's also a lot of other ones called biologics. And then they also put you on steroids because these DMARDs take quite a long time to work, usually 3 months to, I think it's like 3 months to 6 months to take effect. So in the meantime, they're trying to reduce your stiffness and pain and swelling and the inflammation occurring in your joints. So they'll put you on a steroid. Now, steroids are not like what you hear that are illegal in the Olympic Games. These steroids are pills that are taken by mouth. And so this will help decrease the inflammation in your joints, which will relieve the pain while you're waiting for the DMARDs to work. And also non-steroidal anti-inflammatory drugs. These are like ibuprofen, Aleve, naproxen. And how these work is just like what they're called. They're non-steroidal, so they're not steroids, but they do relieve inflammation. So Dr. Lucio next is going to talk about the integrative treatments that are used in the treatment of rheumatoid arthritis.
Yep. I'm going to be talking about the top 10 things you should know about integrative approaches to rheumatoid arthritis. Dr. Sue mentioned a lot of the treatments that are out there, actually they are very effective for rheumatoid arthritis, and this is what you'll see in conventional medicine. Unfortunately, some of them do have significant side effects and toxicities. So it's not a bad idea to make sure you're compliant with conventional medicine prescriptions, but also you can use some of these integrative approaches to augment the conventional medicine techniques as well. To begin, one is exercise. Now everybody is a little bit afraid to do exercise, especially if it's a lot of weight loading on the joints, especially if you have rheumatoid arthritis. It can be very painful, but light weight loading and aerobic exercise are actually excellent types of exercise that can be used in rheumatoid arthritis without actually causing further damage. They actually improve the depression associated with the pain, actually help you deal with the pain, keep your muscles strong. The next thing is physical therapy and occupational therapy. Now, the main goals with these really are to make sure you maintain your function and joint stability. Heat, cold massages are used, sometimes orthotics and joint bracing as well in orthotics. Mind-body therapies. Now, I mention this because it's oftentimes overlooked, and sometimes simple things such as writing in a journal about your condition and how you deal with this is very helpful. Can actually decrease and help you deal with the pain. Because
stress has a lot to do with the onset of rheumatoid arthritis. So the integrative treatment deals a lot with decreasing stress.
Yep, and part of that too is some of the breath works and mindfulness that we actually talked about in some other videos, and these are very helpful even with people that suffer from rheumatoid arthritis. Nutrition. I hear a lot about now this big craze now about fasting and intermittent fasting, and there are some very beneficial effects with fasting. However, with rheumatoid arthritis, you have to be careful in how you do it. Fasting individuals do realize an improvement in their pain from rheumatoid arthritis. However, it relapses again as soon as they start eating, so it doesn't always work as well as we'd like it to. There are some elimination diets, and some people believe that certain foods trigger rheumatoid arthritis. And as you remember, we don't really know what causes rheumatoid arthritis, but one of the triggers may be food. We're not really sure, and it's not a bad idea to do what is called an elimination diet in terms of kind of taking out certain foods from your diet and see if they are triggers for your pain the next day. The next thing I'd like to talk about is coffee. Jennifer mentioned it. From what I've been able to find, if you start exceeding 4 or more cups of coffee a day, you start actually increasing the symptoms of rheumatoid arthritis. I think if you drink less than that, you're not less likely to do it. But if you have severe rheumatoid arthritis, it's not a bad idea to stop. I'm a coffee drinker myself. I think I'd probably try to reduce it first before stopping it. The next thing is tobacco use. There are a lot of good studies that show the relationship between tobacco and the exacerbation of rheumatoid arthritis. Basically, it has to do with an inflammatory reaction that's created in the body. Tobacco really isn't good for anything, and here's just another example. That's the use of supplements. Now, omega-3 fatty acids are probably well known by now. Almost everybody in the audience has probably heard the use of fish oil and omega-3s. They're very effective, and there's a lot of good studies that show that they do provide an anti-inflammatory effect. Some things that are also along that line include conjugated linoleic acids, which are in the form of borage oil and primrose oil. And we will spell these out for you on a slide here so you don't have to remember. Supplements that can be used include antioxidant vitamins such as vitamin E, vitamin C, selenium, and vitamin D, and we're going to put dosages, recommended starting doses for that as well.
Make sure vitamin D is in the vitamin D3 form, not the vitamin 2.
That's a good point.
Because the vitamin D3 is much more well absorbed than the vitamin D2, so just be careful when you're at the store.
Yeah, and they use vitamin D2 is actually available, and it tends to be cheaper than the vitamin D3, but it's not as absorbed as well. Other supplements include calcium. Also, the other treatments that can be used Some botanicals. Ginger root has been very commonly used for anti-inflammation, and a typical starting dose is around 1 gram 2 to 3 times a day. And then if it doesn't help, then start including turmeric, 0.5 to 1 gram 2 to 3 times a day, along with the ginger. Now these are very healthy for you. Now if you take turmeric, make sure you take it with black pepper, or else it won't be absorbed adequately into your system, and really the best way to take it is on an empty stomach. Acupuncture and yoga. Now, acupuncture, I couldn't find really a lot of strong studies that show that it works, but it's not a bad idea to try. It may be very helpful for you. Yoga, because of its ability to help you meditate and control your breathing and helps reduce stress, this can also help with your symptoms of rheumatoid arthritis, in addition to increasing your flexibility. Last thing I want to talk about is other therapies such as Ayurvedic, traditional Chinese medicine, and homeopathy. Now these things are very, very helpful in many disease states, but when I looked at a lot of the studies and how they relate to rheumatoid arthritis, they're just not there available yet. It's not a bad thing to try if you're trying to look for different options, but I really couldn't find too many studies that show that it works.
Now next week, what's our topic?
Adrenal fatigue.
So adrenal fatigue is also called adrenal gland burnout or hypothalamic pituitary adrenal hypofunction. So
it's a mouthful.
It is. So hopefully you can join us again. We appreciate it. Please leave a comment below if you'd like to know more different topics in the future.
Thank you.